The cases that I have seen of phantom limb pain have been primarily related to the lower limb. The elements that have been in common is that they all have had cardiovascular disease with peripheral vascular involvement being the predominant feature. As a result of that, they will have a long history of having had revascularization procedures that have failed, of having had sometimes surgical attempts to bring some form of blood flow to the limbs to try and salvage. They have certainly had plenty of pharmacological management beforehand, and they have eventually undergone an amputation. The majority of these patients, as a background with regards to their comorbidity, have diabetes. The majority of them smoke, some of them heavily, some of them less heavily. They often have had diets that have led to increased level of fats and lipids, including cholesterol, in the bloodstream, as a result of which they have had an increased risk to developing the cardiovascular problem. And also often there is a history of not necessarily severe, but certainly above average alcohol consumption. Therefore, the comorbidity can be very significant. And that has implications with regards to how, from the physical perspective, the symptoms will affect them after the amputation. All chronic painful conditions have a psychological dimension as well. All patients who suffer from chronic pain eventually will undergo the downward spiral, where any type of activity increases the pain, which then in turn will lead to a reducing ability to do things, to reducing functional capacity. There are also the psychological elements of the frustration, the low mood, the loss of self-esteem that comes associated with reduced capacity. Those can often be compounded by the habits that I described above. And therefore, there has been some attempt to try and explain the occurrence of phantom limb pain on account of psychological distress. And certainly, the principle that psychological distress can magnify the feeling and reporting of both pain and disability would apply to patients who have a long-standing problem that has evolved into presenting as phantom limb pain following an amputation. So all these aspects, both the physical, but also more importantly, the psychological elements that encompass the whole pain experience have to be addressed when we are looking into treatment.